Hello, my name is Mary Beth Howard, and I am an assistant professor of pediatrics in the Johns Hopkins Children's Center and a pediatric emergency medicine physician. I'm excited to share with you today a study that we presented at the Pediatric Academic Society Meeting entitled Characteristics of Infant Emergency Department Utilization in a Healthcare System. It is well established in the literature that frequent utilizers of the emergency department make up a substantial share of overall emergency department use. Frequent utilizers of the emergency department have become a target for quality improvement and patient care initiatives with the goal of improving care delivered while limiting inefficient healthcare spending. Within the pediatric population, there is notable variation in emergency department use by age. Younger age has been consistently identified as a risk factor for frequent and recurrent emergency department use. Infants, or children less than 1 year of age, without chronic conditions are most likely to make up recurrent, low acuity, and low utilization emergency department visits. Across pediatrics, those under 1 year of age have unique health and developmental needs. These include increased risk of serious bacterial infection during the first 3 months of life, or increased risk of decompensation from gastrointestinal and respiratory illnesses, which are routine pediatric complaints but may present more subtly or more acutely in infants. Their limited ability to communicate and indirect signs of illness may also contribute to heightened parental and provider concern. As a result, a better understanding of health service needs of infants who visit the emergency department may help inform targeted interventions to decrease unnecessary emergency department use and improve healthcare delivered to children in their first year of life. So the goal of this study was to compare patterns of emergency department use for children less than 1 year of age by visit frequency and resource utilization. To do this, we performed a retrospective cohort study of infants less than 1 year of age presenting to one of 5 emergency departments in the Johns Hopkins healthcare system over a 5-year period. We counted the number of repeat emergency department visits over the subsequent 1 year period after the index visit, and then totaled the number of visits for each infant over this 1 year follow-up. Patient characteristics such as age, sex, race, ethnicity, and the presence of a chronic condition were analyzed. We also analyzed visit characteristics such as arrival day and time, visit acuity level, and whether the patient was admitted or discharged, as well as any testing and interventions during their emergency department visit. Across over 20,000 infants with over 30,000 visits during the study timeframe, a third had more than 1 visit in a year. Across all visits, over half were low acuity, and over 80% of patients were discharged. The most common diagnoses were respiratory disease, fever and viral illnesses, and gastrointestinal diseases. These visit features remained constant despite increasing number of visits. And as the emergency department visit frequency increased, there was an increase in the percentage of children who were older, non-Hispanic Black, and triaged as low acuity. In the infants with greater than 4 emergency department visits during the study timeframe, they were found to be more likely to be without a chronic condition, have no medications or testing ordered, and to be discharged from the emergency department. Overall, we concluded that there was a disproportionate share of emergency department utilization for those with repeat visits without chronic conditions who were least likely to need medication, testing, and hospital admission. This description of patterns of emergency department use in the infant population will be helpful to develop interventions to reduce frequent emergency department use in this known high emergency department utilizing population. Next steps include understanding the motivators to repeat emergency department visits in this population. And if it is found that they are due to the need for education or convenience, improving the access to outpatient healthcare venues needed by infants. I would like to thank my mentors who helped with this study, Drs. Kemi Badaki and Tish Ryan, as well as the Precision Medicine Analytics platform at the Johns Hopkins Institute for Clinical and Translational Research, from which this data for the study was extracted. Thank you.